Well, I think it's very important here to understand that speech or the articulation of sounds is actually a very complex process, and it requires many things to occur in a small amount of time in order for everything to sound correct. If we really think about it and break it down, what's the first thing that we do when we go to speak? We have to take a breath. So we have to have that proper breath support. That's one thing that we have to consider. On top of having that breath support to sustain our message, we have to have things like appropriate jaw height. Our tongue has to be in the right position. Some sounds we need the use of our teeth. Some sounds we use our lips for. So for some of our kiddos who have decreased muscle strength, an enlarged tongue, they may have lost dentition, they may have orthodontics in their mouth, making it difficult for them to produce these sounds correctly. We just have to remember that it's a marathon. It's not a sprint, and it's going to take time. And sometimes it's requiring us to build strength in those muscles before we can achieve that correct sound. And there's something that I wanted to share with everybody, and I actually got this from a speech therapist who speaks nationally. Her name is Carrie Ebert, and it's really just a simple visual. And this is the visual, and it's nothing more than a big bowl of white M&Ms with a blue M&M in the middle. And what this is to represent, and I guess I should also add that Carrie Ebert is very passionate about parent education and parent coaching. And so this blue M&M here represents the 1 hour, maybe 2 blue M&Ms, 2 hours of speech therapy that your child may be receiving in a week. The white M&Ms are here to represent every other hour of the week. And what this is fully said to represent is that it's very important to also be practicing this at home. If your child, for example, is working on the K sound, this is a great opportunity to let's make cookies, let's make cupcakes, let's have corn for dinner. Let's find out ways, let's gather all the keys and the cars and the toy cows in the house and hide them and have scavenger hunts. Let's think of ways that we can help work in the sounds that we're targeting into our everyday life outside of the therapy room. Because home practice is really going to help our kiddos meet these goals on top of the time that they have in therapy, although there's only a limited amount of time in therapy. So I just really like this visual because it just really helps us see that so much learning does happen outside of the therapy room too. So yes, it does take time, but it's again, it's a marathon, not a sprint.